Available statistics have shown that cancer is one of the leading causes of death all over the world, with an annual estimated 72,000 deaths in Nigeria alone. Medical experts have identified early detection as a key factor in the treatment and survival of cancer. In this special report, Paul Ezenwa examines preventive ways of tackling the killer disease.
Cancer, a terminal disease, is an abnormal cell growth with potentials to spread to other parts of the body. A number of factors could trigger this in the body, such as smoking, radiation, presence of virus or cancer-causing chemicals, obesity, hormones, chronic inflammations, and lack of exercise. To curtail the spread of this global scourge, health practitioners all over the world have divided into various forms of research, screening and treatment of these diseases, which causes about 72,000 deaths and an estimate of 102,000 new cases annually. In Edo State, the Benin Cancer Registry reported 1,846 related cases of cancer between 2014 and 2016, a situation which has prompted advocacy through free screening.
The luck we have is all these cancers, they are preventable, and once detected early, they can be treated. So we thank the management of UBT for this initiative, because what it does for us now is open doors for the public to have an idea of what we do, because we are the first center that started the Well Persons Clinic, where you are apparently well, you just come in and you get screened for non-communicable and communicable diseases. These cancers are part of the non-communicable diseases.
Also, the University of Benin Teaching Hospital joined in this fight and embarked on a 2-week free screening for breast cancer, cervical, and prostate cancer. Chief Medical Director of the University of Benin Teaching Hospital, Professor Darlington Obaseki, and other doctors say the institution is assisting Nigerians as part of its social responsibility.
Our statistics from UBTH, monthly statistics, weekly statistics, shows clearly that cancer is the #1 cause of death in UBTH. Of course, we are a referral hospital, so maybe might not be the same population wide, but most of the cancer cases, they will eventually end up in UBTH, and it's probably #1 cause of death. So we felt that it should be something we should talk about, something we should do something about. We can do more, and we are using this opportunity to try to educate our society, our citizens, about how to prevent and for them to come early for screening. So if these cells have grown beyond a certain site and have moved all over the body, it's very, very hard to achieve cure. But if it's when it's just forming, still at that particular organ, very early on, surgical intervention, different approaches can be used to cure it. Like one of the service, you can use what we call cryotherapy to freeze it and kill it off. So it's curable.
You know that even beyond Nigeria, cancer is the most common cause of deaths in the whole world as we speak right now. And apart from that, cancer is also the most common disease entity we have globally as we speak. People talk of hypertension, people talk of diabetes, but among both communicable and non-communicable diseases, cancer is the leading cause of mortality and morbidity globally. Then when you come down to Nigeria, the situation is not also different. The situation is also similar, because as we speak, cancer is also the most common disease entity in Nigeria as we speak. Even bringing it down to Edo State is the same trend.
Abimbola Oyetunde is a journalist who works with a radio station. She is happy with this exercise and encourages members of the public to take advantage of offers such as this to ascertain their status.
I feel is a laudable thing to do, and it will help Benin residents. It will go a long way in letting them know the status in terms of health. And as we heard earlier, breast cancer is the highest in the country and globally as well, and we need to curb it. So it's a good thing they are doing it and making it go public. The awareness is great, and we commend UBTH for this laudable program they are doing.
It's a very essential service which many people need to undertake, because it is one of the biggest problems we men have. And I've lost some friends even recently due to this cancer. So I will encourage men particularly to come forward and carry out this test. because life is short, and it is even worse when you have it and your children, your family members are traumatized.
Despite the steps taken and canvassed by experts, one ingredient that poses as a clog is the lack of adequate sensitization for the people on the need for regular checkup. Paul Ezenwa, TVC News, Benin.